When your baby is injured at birth, you have questions. The injuries can be lifelong and devastating. And whether it be brain damage, shoulder dystocia, or some other neurological injury, you need answers. When your baby has brain damage at birth, there are 4 questions that must be answered. The first question is the APGAR scores. The APGAR scores are a number that's assigned to your baby's well-being 1 minute after delivery, 5 minutes after delivery, and 10 minutes after delivery. A score of 7 to 10 is normal for the APGAR scores. A score lower than 7 is abnormal. If your baby has an APGAR score that's lower than 7, 1 minute, 5 minutes, and 10 minutes after delivery, that's a sign that your baby was not getting enough oxygen at birth. That's the first of the 4 factors. The second factor that you want to look at is called the cord pH value. pH value is a blood test that's taken of the umbilical cord, and it would show the buildup of acid that's in the blood at birth. So if your baby's born, the doctors will take the umbilical cord, test the blood, and if the cord pH value is lower than 7.3, that may be a sign that your baby was not getting enough oxygen at birth. So the medical term for that is metabolic acidosis. What that means is because the baby was not getting enough oxygen, acid was building up in the baby's blood system. The third factor that you want to look at is called multiple organ dysfunction. When the baby's brain is not getting enough oxygen around the time of labor and delivery, what can happen is that as a survival mechanism, the baby's body sends all of the vital blood to the brain and to the heart as a survival mechanism. When that happens, there can be damage and injury to the liver, the kidneys, and other vital organs. If your baby at birth has evidence that its kidneys, liver, perhaps its heart are not functioning the way that they should, that could be a sign of multiple organ dysfunction. That's the third of the 4 factors. The fourth factor is seizures. Seizures are an electrical abnormality in the way the brain functions. When there's a lack of oxygen and blood to the baby's brain, there can be seizures within 24, 48 hours, or perhaps longer after birth. When your baby develops seizures, it is the convulsion of the limbs, the arm, and the legs due to abnormalities in the brain. So seizures are the 4th factor that you want to look at. If you have 3 or more of these 4 factors, it could be a sign that your child has a medical condition called hypoxic ischemic encephalopathy, or HIE. HIE is a fancy medical term that just means that the baby has brain damage caused by the lack of oxygen around the time of birth. If you have questions or if you want more information, you can get my free ebook, The 7 Deadly Mistakes of Malpractice Victims, at my website, Protecting Patient Rights.